Bismillahirrahmanirrahim. I'm your course instructor of the subject of gynecology. My name is Dr. Qurrat Nazar, and today we are going to discuss the third topic of our chapter of the postnatal period. And in this chapter, we will cover the assessment plan of postnatal period. Previously, we have discussed that what is postnatal period and what are the immediate problems which women need to face during this problem. So, we are going to start our next topic, which is the assessment plan for the postnatal period mother. Ideally, the women health physiotherapist should assess each new mother as soon as possible in post deliveries and in antenatal periods too. But in order to determine her priority needs, it may be that another health professional can be equipped with the skills to perform a risk assessment, and the client, if necessary, be referred on to the physiotherapist for specialist assessment. Awareness of needs, awareness of needs proportional to mode of delivery is actually very important. So basically, the women's health physiotherapy play a major role in planning assessment plan for the postnatal period mothers. Thompson et al. Conducted a study in 2002, and its study shows that primiparous women were most likely to report perineal pains and sexual problems. Likewise, cesarean birth mothers have also some type of pains and also some type of issues which they have to be faced after the delivery of the mother. And when these issues compared with unassisted vaginal deliveries, then they have some different type of problems. When more likely suffer to exhaustions and bowel problems, the women who actually give birth to their baby by the cesarean sections, they actually suffer lots of exhaustions and bowel problems, and they reported less perineal pains and urinary incontinence, and they were most likely to readmitted. It means that women who feel perineal pains have the chance of readmissions in the hospitals too. Forceps and venous deliveries are also the cause of painful perineal areas. It means that forceps and other type of assisted deliveries also cause a problem of perineal pain. And there are some of the symptoms which used to look out and for taking a considerable refer if non-physiotherapy assessment happens. And these assessment basically includes some type of problem which are listed here. So these type of problems are the diastasis recti abdominis muscles, inability to voluntarily contract the pelvic floor muscles, perineal pain and discomfort, symphysis pubic-like pains, and the referred pains associated with the symphysis pubis, back pain, or any type of discomfort. So these things should be considered under the concentration of the women health physiotherapist. So the women health physiotherapist allocate the problems and made a proper plan of care for the mothers who have these type of problems. After discussing some main points which women health physiotherapists also need to be planned and also need to be learned for any problem which postnatal periods need to be evaluated. After that, we are going towards the next topic, which is individual versus group education. Yes, individual versus group education is also very important for both the mother and also for the women health physiotherapist. Because if individual versus group education is held, then there are so many problems which should be resolved for the mothers who have not taken antenatal classes. Immediate advices and initial exercises education is best given individually, and specific interventions were also needed, and they should be commenced as soon as possible. In terms of cost effectiveness, it may be then be appropriate to continue interventions in a group. Individual suitability will be determined by assessments. The majority of new mothers enjoy the group approach. There are so many mothers who learned with the help of the group approach. Benefiting from the group interaction, the group approach is particularly useful in delivering the hidden curriculum. The wealth of information and advices over and above simply information and above simple exercises instructions, which is particularly important for those women who did not attend antenatal classes. After this, values come. And what is the importance of value in educating a postnatal mother? Yes, it is very important. The venue for the postnatal group can only be determined by what is available within the ward, day room, or parent education room. It means that venue is basically in venue, a mother should be educated but for a very limited time. Most women are happy to participate, but the physiotherapist must be sympathetic to the issues which are related to the new mother, such as baby feeding problems, changing nappies problem, health concerns, waiting for the doctors, etc., and the plan of group which actually women need to face accordingly. If appropriate, the baby can attend to. It means that baby is so little, how he could take education, but baby can also take these classes along with the mother. It means that this type of visibility also be given to the mother that they should carry their baby along with them. This provides an ideal opportunity to discuss functional activities and their potential effect upon physical symptoms. That is baby feeding and nappy changing and their effects upon the neck and back. The benefits of group activity for outweigh the difficulties sometimes involved in getting a group together. Now, after discussing a venue, there comes a very important point from the health point of view for the mother is exercise. Yes, exercise is very important for the mother to achieve. The new mother should be encouraged to be mobile and therefore reduce the risk of circulatory and respiratory dysfunctions. If she is confined to do exercises and if she is confined to bed for a prolonged period of time, then control and deep breathing exercises are very helpful, especially for the mothers who face the problems of circulatory dysfunctions. Now, pelvic floor muscle exercises are also very valuable for their strengthening and pain relieving properties. They will also speed healing by reducing edema and encouraging good circulation. These exercises should be taught antenatally, and these exercises have slow, progressive, controlled contractions along with fast, short, sharp contractions, and it can also be practiced little and often. It will take all the physiotherapist skills too, and if needed, the areas for the interventions and areas for the inventors to achieve compliance can also be taken. The mother may have an acutely painful perineum or severely painful stitches and may be exceedingly reluctant to exercises. In order to gain compliances, it is essential that the mother understand the benefits of performing the exercises. 3 or 4 muscle contractions will begin to give relief by virtue of the pumping action of the local circulation. So, finding the right standing position for the exercise, symptoms to look out for considerable referral if not physiotherapist assessment, and they include diastasis recti abdominis muscles, inability to voluntarily contract the pelvic floor muscles, perineal pain or discomfort, symphysis pubis pain or referred pain, back pain, and discomfort. So, in order to gain compliance, it is essential that the mother understand the benefits of these exercises. If mother cannot understand the benefits of these exercises, then she feels that this is a burden for her. 3 or 4 muscle contractions will begin to give release by virtue of the pumping action on the local circulation. Finding the right starting position for the exercise will be key to effectiveness. For example, lean sitting positions increasing external proprioception for the mother anterolaterally. Sitting on the gymnastic ball, crook lying position, standing prawn lying positions are very effective for the mother to recover from the pain, especially the perineal dysfunction problems. A more efficient contraction may be obtained by contracting the transversus abdominis before engaging the pelvic floor muscles. Basically, this study is conducted by the Watkin in 1998. Now, there are two essential pieces of early advice. And basically, these early advices can be given to achieve physical relief and increase confidence. And these are first, to contract the pelvic floor muscles every time the intra abdominal pressure increases. For example, during coughing, sneezing, and laughing, the intra abdominal pressure of the mother gets increases and it actually creates some discomfort and painful condition on the sutured area. Support sutures by applying pressure hand to the perineum area using sanitary pads or pads of soft toilet paper when defecated is attempted, and until the perineal pain subsides. For some women, the memory of the postpartum perineal pain is more prominent than their memory of labor pain actually subsides. It means that sometimes women feel more perineal pain than the labor pain. It has called the fourth stage of labor. The principles of muscles of re-education actually creates a the principles of static muscle re-education actually creates a static abdominal contraction, which is followed by pelvic tilting, crook lying, and it can also aid the relief of after pains and backache problems. So there are some positions which makes the comfort level of the women. And these are side lying, prawn lying, crook lying, sitting, standing position. The anterior abdominal wall should be drawn in on expiration, thereby increasing muscle tone, then progress through to static contraction plus active range of motions are also very helpful for relieving these type of pains. Pelvic tilting exercises, flexions in progressive ranges of the lumbar spine. It is important to include all muscles of the lumbar spine, and basically Richardson et al. Conducted a study in 1998 and he described the importance of transverse abdominis muscles multifidus as stabilizers of this lumbar spine, and these should therefore be acknowledged in an exercise regime. Looking at the movement and feeding hand to abdomen can increase the facilitation of the contractions. It is important to emphasize that once the exercise have been learned, it is not necessary for them to be practiced whilst lying down. They can be integrated into the daily routine, for instance, while waiting for the kettle to boil. This increases compliance. A static abdominal contraction followed by pelvic tilting like crook lying can aid the relief of pain and backache. And same, the speed of action can be varied from slow hold to tilt relax. And the rhythmical gluteal contractions may help ease the pain from hemorrhoids or bruising type of problems. Now there are some early postnatal classes. After discussing the early antenatal classes, there is a course of early postnatal classes also. And in this classes, we have discussed the different things So, first of all, the setting up of a class. In setting up of a class, currently it is virtually impossible to set up a class within the hospital setting. But there is no reason why this could be achieved in community. The postnatal women actually requires input from the physiotherapist. It means that postnatal women needs the help of a physiotherapist, the expert in human functions in order to return to normal functioning and enabling her to manage her new life. The women's health physiotherapist will know her own patch best and needs to determine the possibility of having a postnatal class in the community too. An advice leaflet can greatly assist the scheme. As with the setting up of any class, the client group should be taken into account. All are individuals happy with being in a group situations and are some likely to feel threatened too. Appropriateness for inclusion should be assessed. After teaching points come, the arrangement of the group should enable all the participants to physically take part, interact with each other, and the physiotherapist see the physiotherapist for the non-physical aspects of the class too. And they can be seen by the physiotherapist. The starting position should minimize risk to participants but enable participation too. Participants may be in a sitting position, may adopt standing or lying positions too. The points to be covered in each position should include sitting, and the sitting should be well supported back and comfortable perineum, exercise in sitting for postures, abdominals, and pelvic floor muscles, regular referral to daily activities in sitting, for example, feeding the baby in order to minimize the symptoms, standing, stable base of support. The women should adopt stable base of support while standing, and she should lean against something to increase the stability of her body, for example wall. She can also use back of the chair too. Appropriate footwear, yes, appropriate footwear is very important for the women to wear. Mules are not a good idea. Exercises in standing for posture and abdominals, and this can reduce the abdominal girth by up to 12 centimeter, especially if also standing tall. Pelvic floor muscle exercises, for example, trunk side flexion, hip hiking, is also very important for the women to achieve. Lying. During lying, the women must use some pillows and wedges to support and exercise progression. If she is doing exercise without any carpet, then she must use mats. And if she is using a carpet, then she must use roll of disposables covering couch covering papers too. Teeth checking for separation of recti abdominis muscles, raise awareness regarding at risk movement of exercises and strong sides. Flexions and trunk rotations while lying should be omitted until the anterior abdominal wall is strong enough to allow these movements without shearing. Now, exercise is also a very important component for the women to adopt because it strengthens the abdominal muscles. Abdominal muscle contraction emphasizes on transverse abdominis and increase the length of hold with pelvic tilting. Progressive progresses to include active trunk movement, for example, head raising and then head and shoulder raising too. It can also raise awareness regarding abdominal domings, posture, pelvic floor muscle strengthening, all could be performed in a bath too. Now comes to the newborn baby care. Yes, newborn baby care is also one of the very important component of postnatal period. Newborn baby care must always be taken with respect to starting position and exercise. With any women experience symptoms of symphysis pubis dysfunction, SPD. Now comes to the relaxation. If appropriate, the class may be completed by a short period of relaxation. Relaxation techniques could be used successfully to reduce tensions and maternal fatigue. This study is basically conducted by Safford et al. In 1999. This element of the class should be included only if the physiotherapist has the appropriate knowledge and skills. It is essential that the women be risk assessed as to their suitability for the elements of the class 2. Relaxation therapy has the ability to enhance emotions, and the physiotherapist must be absolutely sure that she or he has the skills to handle an exacerbations of the emotions and she must know who and how to refer on to other professionals too. So comes towards the relaxation therapy. If this therapy is taken in a wrong hand, then it actually creates some potential dangers. The environment must allow for comfort of the participants, sufficient space for adequate pillow use, appropriate temperature, etc. And for it not to be a problem if participants fall asleep too. It means that the participants should be at a comfortable level. The mother and the baby should be safe and comfort level should be provided to the mother for teaching this relaxation therapy. Simple relaxation suggested linked with deep, calm, slow breathings will often result in some women's falling asleep. This usually demonstrates their intense fatigue and the importance of occasional power naps once they return home. The skill of relaxation also facilitates the let down reflex for breastfeeding, and this study basically conducted by the scientists Scaffolds et al. In 1999. Now let us discuss some of the educational principles of the postnatal period. It is accepted that individuals learn best from taking parts, that is, doing the exercises, if space, time, ability of the client allows. They are less likely to be afraid to do the exercises at home if they have tried them under supervision. It means that mothers first do exercises under the supervision of the women's health physiotherapist. Next best from watching. If women have no supervisions of any physical therapist, then she must watch from some media. If space-time availability of the client does not allow participation, then she must use some type of YouTube medias, ठीक and from them she can take the advantage and she can do some simple exercises. A demonstration of the exercises with visual aids in the form of a charts, diagram, models will increase the mother's understanding of the purpose behind performing the exercises and therefore age compliances. Least best from listening alone, last resort in terms of compliances, and all retain information better if there is a combination of the above and it is supported by literature too. Advice with regard to everyday functional activity such as baby bathing, lifting or carrying, cot or pram heights, etc., should be given by the experts, the physiotherapist. The physiotherapist has the knowledge and skill to teach the mother approaches that will minimize the effects on the musculoskeletal system. It is essential the women health physiotherapist does her homework, reaches the in vogue products on the market, and is prepared with the appropriate advices for the parents too. For example, on babysitting or car seat, it is essential that the mother should be educated, not instructed, for the exercise program or advice to be meaningful or lifelong. So, maintenance of a good posture is essential at all times. Here you can see the good posture of a woman. The woman is doing work. The woman is doing work outside or in the home. She must maintain a good posture. Appropriate use of carrying slings basically avoid the problems of the back problem. And then if women use a pram, she could easily handle the prams with her hands and she can easily walk without causing any problem on her back. Now there are some ergonomic principles which need to be taught to the mothers. The new mothers can experience cumulative physical trauma as a result of her delivery. It is essential the women health physiotherapists also educate the mother in relation to these ergonomic principles. The more the physiotherapists educate the more the mother adopted these positions. That is why these ergonomic principles are the component of the antenatal period too. And then they will also be discussed after the delivery of the mother for those who actually skip the antenatal classes. The first ergonomic principle which I'm going to discuss is sitting. The woman thigh should be fully supported or at least two-third part and horizontal. It means the woman should adopt the sitting surface position and she should not extend as far as the popliteal fossa to avoid any potential impingement on the area. She should flat her feet on the floor. She use stable base of support or full support. Her weight should evenly be distributed over both the buttocks. She should not sit on one side of the buttock. She properly put weight on both the sides of the ischial tuberosities to get avoid from any type of soreness or perineum or hemorrhoid-like issues. And if she have any perineum and hemorrhoid issue, she must use the cushion. She should sit in the surface depressible to allow for pressure distribution. If the surface is not allowed a depressible surface, then she must avoid to sit on a hard surface. Trunk fully supported maintaining natural spinal curves and in standing position, her feet should be slightly apart, angled lateral rotation of the hip following through line of femur slightly not like a brenial. Weight evenly be distributed over both the feet. Soft knees not flexed just off for full flexion. Do not lock them back. Shoulders should be relaxed, not retracted or elevated. Arms held closely at the side maintains natural curve of the spines, head in line with the trunk. Kneeling. She must avoid sustained isometric flexion, rotation, try to keep movements within the sagittal plane, perform high activities at an appropriate height surface. During high knees, her knee hip width apart, knees directly under the hips, maybe on a cushion, maintain natural spinal curves. During knee sitting, she must adopt bilateral sitting. She must use cushions to the back of the knees, at least one half of the knee sitting too. And in unilateral condition, if she sit on one heel, other hip forward flex with the foot flat on the floor. While feeding her baby, the new mother may be feeding her baby 8 or more times each day. The new mother may be feeding her baby 8 or more times each day. However, what should be a happy, relaxed, shared time between mother and a baby? Baby has a potential for resulting in musculoskeletal symptoms if she is not positioned in a proper way. The women health physiotherapist is the best person to teach the mother with regard to good positioning, but the midwives also teach the mother that what is the best available type of position she used to carry on a regular basis. So, sharing of knowledge and skills between professions is essential for the benefit of the mother and for the baby too. Here you can see the picture that how mother feed her baby in a comfortable position. If you see in the first picture where woman is sitting on a chair, let closely observe the position of the mother and the baby. Woman comfortably supported with a pillow on her back, and she comfortably placed a wedge below her feet. And then she also take pillow on her lap and she holds the baby firmly. And here in the second image, you can see that mother is feeding in a sitting position. She comfortably placed her knees and her back with pillows. And then she is able to feed her baby in a comfortable position. So, by adopting this position, the mother can relieve from many of the problems. And here you can see in the lying position that mother is comfortably placed under the pillows. She comfortably flexes her knees and she closer the baby towards her breast. And this is how the baby easily feed from the mother. Now, these images, you can see that mother is very comfortable in feeding her baby. And basically, these images help us to understand that how mother overcomes the problem of feeding. And these problems and these positions not only help the baby but also the mother to get relief from the problem of back pain. Now there comes another challenge of the nappy changing. Nappy changing is another activity that results in incapacitating pain. A mother can change a nappy 10 times a day or more than 10 times, and it is therefore considered a frequent activity for the mother. And this frequent activity actually creates musculoskeletal type of problem, and if proper ergonomic principles are not followed, then the positions that increases the risks to the mother should be avoided. For example, sitting knees extended, trunk flexed and twisted. It is the role of the women health physiotherapist to teach not only the mother but other health professionals too so that they are able to reinforce the principles. Many hospitals today insist that nappy changing is carried out in a baby's cot. The physiotherapist should be involved in the development of the policies that not only follow the infectious control guidelines but also reduce the physical risk to the mother too. Suggested position for nappy changing are here. Here you can see that how the mother is changing nappy. In first picture you can see that mother is standing and she actually placed the baby in a suitable height. Mother should use some suitable height so that her she cannot bend herself more than her available range. If she bended herself again and again, then it can create a problem of low back pain for the mother. And in the kneeling position, you can see that mother again uses a comfortable height for the baby. She placed the baby in a comfortable height and then she changed her nappy. And in the floor, you can see that mother is sitting comfortably on the floor, and here you can see the posture of the mother. And this posture actually helps the mother to relieve from the symptom of the SPD. And see how she placed her baby on the floor and then she changed the nappy of the baby. Bath time. After discussing the nappy changing, bath time is also a very fun time for the mother, but can also be another source of musculoskeletal problem too. Risk factors during the bath is follow. Low baby bath on a standing position results in a high risk of isometrics and trunk flexion positions. A bath that requires filling resulting in the carrying of water in jugs and buckets and then the carrying of the bath full of water in order to empty it. A variety of baby baths are now available to get rid of these type of problems. Other options could also be used a special washing up bowl which is a non-slip type of quality. It can be used on a kitchen or on a bathroom too, and well-cleaned bathroom hand basin is also be used for bathing the baby. If the mother has the knowledge of ergonomic principles, she can hire or purchase something that is appropriate for her and all other skins to bath the baby, thereby minimizing the musculoskeletal risk during the baby bathing. After the baby bathing, there are some very important points which need to be remembered. It is important that the women health physiotherapist has a belief in what she is doing, has the ability to motivate and encourage the mother and to, above all enthusiastic teams too. Many women will not want to exercise and may have to be persuaded to participate in it. Do not burdens new mothers with too many exercises because if you advise lots of exercises to a new mother, she get irritated with it, and there are the possible signs that she did not do any single exercise. Always encourage the mother, encourage movements, reassure them that the stitches will not pop out if they did exercises, if they start walking, and if they start small exercises. Although birth is not an easy process for the women, but she can also enjoy the birth experience if she is taught properly. Abnormal and ill babies and neonatal deaths also occur in this gestational and delivery process. And they are very difficult stages for the staff and especially for the young and unexperienced couples too. The women health physiotherapist should establish the priorities and teach the mother exercises that are appropriate. She should not be afraid or empathizing with parents in their anxieties or even joining them in their grief too. She should educate the couple to adopt some postnatal home exercises too, because postnatal home exercises are also very important for the mother to adopt actually. To improve circulation during the first few weeks, the mother should try to have a daily walk with her baby in a sling or in a pram. The change of scene will also benefit her emotionally. Pelvic floor muscle exercises can be done around the house too. They should become routinely part of the other activities. Reminders may be needed. Post it notes in obvious places, for example, inside the kitchens, cupboards, phones, nursery. She must attach some reminders in the form of a sticky notes so that she should know that she must have to do exercises for making herself better. Rest and relaxations are essential and should be continued on a regular basis. whether it be in a chair or a bed or a floor. Postnatal, ex- Postnatal exercises classes in the community, individual assessment with regard to appropriateness for attending at a postnatal class is essential. The status of a mother abdominal and pelvic floor muscles should be such that she is able to progress exercise activity. Perineal pain, stress incontinence, and backache are the most common conditions that may still be giving problems. Ideally, the women's health physiotherapist in the acute sectors should refer, where necessary, to their colleagues in the community. In general, women wish to attend postnatal classes because they have an issue with the body images. For example, abdomen, hip, thighs, and she also feel a need for companionship and support too. The long-term benefits, hopefully, of attending a postnatal class will also have an improvement in the bits they cannot see. Their pelvic floor and vagina, the hidden agenda of the class is the group interaction between women, all experiencing a particularly special time in their lives that can also be very daunting and stressful on occasions too. Just being together and sharing can be a very worthwhile outcome. The classes, if appropriate, should include exercises with the babies. The structure of the class should be flexible. For example, if the women appear particularly tired, then perhaps emphasizing can be placed upon relaxation too. So, in this step, you can also enhance the women, you can also educate the women the relaxation therapy. Time should be built into the class to enable feeding, nappy changes, a drink, and a chat. Useful topics can be brought into a chat so that it becomes semi structured and informative. For example, she can also have to face fatigue, depressions, anxiety, loss of libidos, and this can be vanished if she adopted a proper way. Now, the very important component is the return to sport and exercise issues. Even the athlete, dancers, or dedicated sportswomen will have reduced the intensity and amount of exercise by the end of her pregnancy. After the postnatal period of recovery and gradual restoration of the muscle strength, these women will be ready to return to their pre pregnancy activities. Whether the pre pregnancy level of the activities considerably decrease prior to the delivery, a gradual reintroduction of sport and training schedule is essential for the women to adopt. This is particularly important for the non-athlete women who feels that she is doing something once her baby has settled down. She should be discouraged from joining a mass aerobic class at the local leisure centers. Jogging long distances and cycling many miles if she have not exercised for a long time are very harmful for the mother, especially in the antenatal period. It is important that qualified instructors who understand the limitations of post-pregnancy women supervise class and give activities for the athlete women. A cumulative role here for the women's health physiotherapist is to give an ideal activity for this woman, which is swimming. Now, the conclusion of this assessment plan is the baby and the mother. Baby and the mother postnatal exercises in the community basically provide an excellent forum for introducing education to prevent health problems, to prevent healthcare issues, not only for the mother and for the baby too. I hope you all understand this topic, this chapter of postnatal period very well. So, Allah Hafiz and thank you.